All right. My name is Rehan, and I'm gonna be conducting GI, musculoskeleton, and neuro assessment on you. Do I have your permission to record this for the school purposes?
Yes.
All right. Can you go ahead, please tell me your name and date of birth?
Marietta Ahmed, 2681.
Great. Thank you so much. Do you know where you're at?
Yes, home.
Okay. Do you know what year is it?
2024.
You know who's the president?
Yes.
Who's the president?
Biden.
Awesome, thank you. So, with general inspection, she looks pleasant. She's maintaining eye contact during the interview. She's alert. Her skin color is consistent with her ethnicity. So we will start first with inspection of the stomach, abdomen. So I'm gonna help our patients lay down. All right, so due to privacy purposes, our patient will not be moving or shut up. I'll do our best to do the assessment as is. So upon inspection, the skin looks normal. I do not see any distension or peristalsis. We will be doing next, we'll be auscultating all four quadrants. Bowel sounds are normal on upper right quadrant, left upper quadrant, lower quadrant, right lower quadrant, and left lower quadrant. Next, we'll be listening for abdominal aortic pulses, iliac pulses, femoral pulses, and kidney stenosis. So right above the umbilicals, I'll be listening with the bell to flip over to make sure there is no bruit. No bruit heard. I will be moving to iliac, changing it to bell. No bruit heard. Changing it to bell to listen to the. No bruit heard. Now we'll be moving down to femoral. No bruit heard. And the bell. No bruit heard. In order to listen to kidney stenosis, we will have to, since it is towards the flank, we will be listening to on the flank area. All right. No bruit heard. Now, next we'll be moving into percussus. So we'll start with the upper left quadrant. As we move from upper left quadrant to right quadrant, we hear tympany because of the ascending colon and the gases. Right lower quadrant is more dull. Next we will be percussing for aortics, abdominal aortic. Excellent. We'll be doing light palpation now. While you're doing light palpation, you want to look at your patient's face to make sure that they're not grimacing. That could cause peristalsis if pressed too hard. about 1 centimeter deep. Okay, now we'll be doing deep palpation. All right, so here we are doing palpating for spleen. There we go. And then we'll be moving to right upper quadrant to, and here you want to do a rolling motion to feel the edge of the liver. Here. Now, when we precussed, and as we move up, we'll hear timpani on the liver, but as we move up, the sound's gonna start getting dull, which tells us the size of the liver. So in deep palpation, we have palpated spleen, liver. The next we need to palpate the kidneys. In order to palpate the kidneys, since the kidneys are flagged, so we'll be palpating the back towards the flank. All right. Next, we'll have our patient sit up so we can start with upper extremities and joint palpation. Okay, now we'll be starting with inspection of the shoulders. So upon inspection, I see that the skin tone is normal. Both shoulders are symmetrical, no deformities noted. I'll go back and look at the shoulders from the back. The shoulders look symmetrical and no abnormalities noted. So we'll start with palpation. So we'll start with, first we'll start with sternum subclavicle, and then we'll move up to subclavicle muscle joint, and then AC joint, trapeziums, superior sphenosis muscle, spinostenosis muscle, and inferior supinous muscle, rotator cuff, and then we have over here our deltoid muscle. So from here again, we'll go on this side. We're gonna palpate sternal subclavicle, to subclavicle joint, to AC, to trapezius, to superior sphenosis, to spinosis, then again to inferior spinosis, rotator cuff, and then again to deltoid. Now, we'll do some range of motion. So I would need you to raise your hands up, adduction, and cross it down, abduction. Okay. Next thing we'll do is I want you to have your elbows out here. All right, and you'll do adduction, abduction, extension, extension, flexion, extension, flexion, and now we'll do exterior rotation. Just put your shoulders here, and just move your shoulder joints, shoulder exterior, not your arms, just here. Just move your shoulder joints. Exterior rotation, anterior rotation. Excellent. Now we need you to show me your arms. All right, so we'll have your hands. There'll be extension, flexion, extension, flexion, extension. Oh, great. So now we'll go ahead and we'll palpate the elbow joints. All right. So now we'll go ahead and move to the fingers, metacarpals, joints, no bruise, Same thing on this side. Next we will do the Euler joint. While we're here, we'll be checking for pulses, Euler pulses, brachial pulses, +2, abnormalities noted. On radial as well, +2, no abnormalities noted. Excellent. Now we'll be checking for tendon reflexes. Can you have your elbows up this way for me? Okay. All right. Now we'll be doing brachial, Euler, Euler, and brachial. Okay, last thing we'll do is for the shoulders, supine, proning, supine, supine, proning, supine, proning, supine, proning. Excellent. Next, we will be palpating and assessing hip joints. I'm gonna help you lay it. All right. So for modesty purposes, we will not be exposing our patient. All right, so we'll be starting from palpating iliac crust, and then we'll be going down to anterior iliac crust, anterior iliac, moving back to greater truncal muscle, greater muscle mass, back to anterior, posterior iliac, and this is where we'll go down to extraterritorial velocity to make sure there's extraterritorial velocity. This is where you tell the patient that you might be touching the butt area, so the patient is not surprised, to make sure there's no bursts. Next, we will be checking for range of motion. I'll help patients sit up. Can I have you stand down? All right. So now I would need you to adduction, abduction. Excellent. Foot in the front. Excellent. We're looking to see if there's no ataxia. We're looking to see if there's no hip dysphagia. I would need you to turn on side now, and I want you to flex, extension, flexion, extension on both legs. Flexion, extension. All right, the other side. Flexion, extension, flexion, extension. Great. Now we'll have our patient turn this way. We'll be assessing for spine, making sure there's nothing abnormal, everything is symmetrical. We'll palpate the spine muscle down to the dimples and to PSIS muscle. Can you flex forward for me? Flexion, and then all the way in the back. Come up, extension. Perfect. No abnormalities noted. Now, can I have you bend from side to side? This is where we're looking for symmetry to make sure the spine is even. The curvature was even as well earlier. All right. So now I would need you to move from side to side, left to right, left to right. Excellent. No abnormalities noted. I'm going to have you sit on the table back now. Okay, so now we'll start with the palpating the quads down to patella, all the way down to tendons or tendon muscles over here. Okay, excellent. Now we'll start with checking the flexion of patella, deep tendon flexion of muscle patella. So, excellent. Excellent. While we're here, we'll be palpating popliteal pulses, make sure they're even and symmetrical. down to dorsal and posterior posterior +2 symmetrical multis noted. Next, we'll have our patient lay down to check Babinski plantar facial tender to reflex. So in Babinski, in kids, the toes usually flare up. After 1 year, the toes should be curling in. If not, it's a sign of brainstem damage. So we'll start that. I'll touch something sharp, and we will perfect. We see the toes curling in. Perfect. So next we will go. I'll have you set up. Okay. All right. So I'm gonna be testing hot and cold test. All right, close your eyes and just let me know when if it's hot or it's cold. All right.
Cold. Hot. Cold. Hot. Hot. Cold. Hot.
Okay.
Hot. Hot. Cold. Hot. Cold.
All right. Next we will be testing for the sensory. I'm gonna have you keep your eyes closed, put your palms out. All right. We're testing first stenography test. All right. I want you to identify the object and put it in your hand. Can you tell me what it is? If you can feel it, and tell me what it is.
Feels like a coin.
Excellent. Oh, now.
A coin.
All right. Can you feel this?
Q-tip.
All right. Feel this?
A clip.
Excellent. Next we will be doing dull, soft, and sharp test. So you can keep your eyes closed and tell me what you feel. Is this soft, dull, or sharp? Sharp or cold, dull?
Do it again. Sharp. Soft. Dull. Soft.
Okay. Dull?
Dull.
Or soft? Okay.
Sharp. Soft. 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 Soft.
Okay.
Sharp. Sharp.
Dull, soft, or sharp?
Dull.
Dull, soft, or sharp?
Dull.
Excellent. We have all our 3 tests done. Next, I'm gonna ask you to put your arms up here, and be checking. And I want you to go up, palm down, palm up, palm down, fast. Palm up, palm down, fast. So we're looking for any dysymmetry. Everything looks frequent. That's good enough. Excellent. So now I'm gonna have you step down. All right. So next is a gait test. So I want you to foot to heel, 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 to heel. Excellent. All right. I'll have you sit back up here again. All right. You can lay down. Next, we will be testing for cerebellum. So can you touch your heel to your shin, both sides? Heel to shin. Both sides, correct. Both sides. Excellent. No abnormalities noted. Now we'll be testing to see if the patient feels the vibration. I will check the joint. Let me know. Let me know when you feel the vibration when it stops. Stopped?
Stop.
Okay, excellent. Did it stop?
Stop.
Okay.
It stopped.
We will do the same thing on the opposite side. We could do lower extremities. This is to identify for patient with diabetes if they have any neuropathy pain. I'll have you sit up and examine. Can you come down? All right. I would need you to close your eyes. All right. Put your hands up front with palm up. Okay. I'm not noticing any swelling for Romberg test. Everything looks good. All right. I would need you to would you open your eyes now with your palms up? All right. Close your eyes and move your head side to side this way. And I'm going to count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We're making sure there's no frontal shift. All right, excellent. That brings us, you can still relax now. And that brings us to the end of the examination. Thank you.